updated COVID-19 vaccine is recommended for all people ages 6 months and older. It's tailored to the current circulating strains of Omicron. Neutralization studies support that it should be effective against all currently known circulating strains of coronavirus. What we know from historical data is that typically your resistance to infection is best in the first few months after vaccination, and then that immunity tends to wane over the ensuing months. 6 to 9 months later, we typically see lower levels of protection. We're recommending the coronavirus vaccine at this time of year because we are now seeing an increase in cases of COVID-19, and so we're trying to anticipate a winter surge and get people vaccinated before that surge. No vaccine is perfect, but based on historical data, the coronavirus vaccine has been very helpful at preventing hospitalization and death from COVID. And one other newer finding being reported on is it seems to also be very helpful at preventing long COVID, and that is definitely a significant consideration. Because the strain of influenza virus changes year to year, so it's very important to get a flu shot every year so that you get the flu shot that's been tailored to the current circulating strain of influenza. I'll mention there was a nice study from the Southern Hemisphere showing that the current influenza vaccine is anticipated to have about a 50% reduction in hospitalizations. So it's a very effective vaccine for us this year. You should consider getting your flu shot as soon as you can. Typically, we tell most people to wait and not get their flu shot in July and August, but now that we're in September, yes, any time is a good time to get your flu shot. And we do encourage people to get both their flu and COVID shots together for convenience. Getting a flu shot's not just good for you, it's also good for your family and children and other people that you're around. We know from previous data that getting the flu vaccine helps prevent getting influenza, but also there are data to support that if you do get sick with influenza after a flu shot, the severity of your illness is likely to be lessened. RSV is respiratory syncytial virus. It's a cold virus, essentially, that circulates every year, but in certain vulnerable populations can cause severe disease. Vulnerable populations would be children, particularly under the age of 1, and older adults over the age of 60. The picture for RSV this year is very encouraging. We have 2 different types of interventions to help prevent RSV. One is a vaccine. The RSV vaccine is for people aged 60 and older. There were some minor safety concerns, so that is not a blanket recommendation for everybody over age 60, but rather is recommended to be given based on what's called shared decision-making between a patient and the provider, basically balancing their risk of severe RSV with the risk of the vaccine. The other group that's been newly recommended to get the RSV vaccine is pregnant women between 32 and 36 weeks of gestation, as it can help prevent RSV in a newborn infant. Some studies have supported that that's about 50% or better protecting those newborns from getting hospitalized if they get RSV. The vaccine effectiveness studies on that vaccine in older adults are also excellent, about 80% protective against symptomatic disease in the first year and 57% the second year after vaccination. That monoclonal antibody is recommended for all infants under age 8 months and for high-risk infants age 8 months to 19 months. Again, a very effective therapeutic, 80% protection against hospitalization and 90% protection against ICU admission.